Hi, this is Dr. Ryan Saw. I'm a Gonstead, New York City chiropractor in Midtown Manhattan. In this video, we're going to talk about failed low back surgery syndrome. So what the syndrome is this. For those who had the spinal fusion surgery or had their disc operated on, studies have shown the failure rate can be as high as up to 40%. So one of the reasons why that is so is this. Johns Hopkins Medical School released a study and they talk about 25% of low back pain is not from your back. It's actually coming from your pelvic foundation, meaning your hips. So, to simplify it, the explanation, our pelvic foundation is a lot like foundation for a house. So if your foundation is nice, strong, and stable, your structure above it will be stable and you'll have a stable spine. If your foundation is unstable structure, unstable spine. So the other reason is also due to a structural shift. And we're going to talk about that in detail with these two recent x-ray cases. Okay, so before we jump into the x-ray cases, I want to clarify what a lumbar structural shift is. Okay, so I have right here a model of the lumbar spine. Okay, so tilt so we can see in the front. This right here is a nucleus pulposus. Okay, this fella acts like a ball bearing and allows us to pivot in all degrees of motion, such as forward, backwards, tilt to the sides, rotate left and right. And as we see over here, we have a lot of rings surrounding this nucleus pulposus. Okay, so we have 25 of these layers. It acts like a containment dam to keep this jelly ball bearing in place. Now, when we have some kind of traumatic event, okay, and it causes a breach to these containment dams, okay, the ball bearing can leak out in three common directions. It can leak out backwards to the left, backwards to the right, or straight backwards. So when that happens, okay, this whole entire structure itself will shift backwards as such. And this is what we're looking for on the x-ray. In this x-ray case, this particular patient had a microdiscectomy at the 5th lumbar disc. After the surgery, this patient continued to experience sharp low back pains while sitting, sharp left sciatica pain all the way down to the left foot, to the bottom of his left foot, plantar fasciitis, and every time this person walked, this person felt like there was pins and needles underneath the left ball of his foot. Okay, so normal is supposed to look like structure should be proper alignment in the front and the back, and also relatively parallel with a slight little tilt backwards. But what we don't want to see is a severe tilt as such. Okay, so in this particular patient, his structure was misaligned backwards and tilted inferiorwards, just like what we can see in this x-ray as such. Okay, so because it tilted inferiorwards as such, as you can see, the structural shift, it puts a lot of pressure on that nerve. That's why it was producing all those symptoms. So what we did in this office was structurally realign him, which alleviates and took a lot of pressure off that nerve, and his symptoms are significantly better, where he no longer have left sciatica, he no longer has left foot pain, and no more low back pains. In this x-ray case, we have spinal fusion. The patient initially experienced a lot of sharp discomfort in the low back and had a surgery. After the surgery, for the past 10 years or so, the patient continues to experience a lot of low back pain while standing, sitting, getting out of the car, and getting out of bed. And that's because ideally the structure should be in proper alignment. Okay, just like railroad tracks, I don't want to see this thing out of alignment. It should be in proper alignment front and backwards. So when the structure shifts backwards, okay, and also tilt inferior, it puts a lot of obstruction to that nerve, causing all those symptoms. And that's what we see in this case over here. I drew these lines to show the proper alignment. As you can see, these two lines do not line up. This structure has shifted backwards by 7 millimeters. So it's no surprise that nerve has a lot of symptoms to it. So what we did for this patient was we structurally recorrected back into proper position, took a lot of pressure off that nerve, and the patient no longer experiences any discomfort while standing, sitting, getting out of the car, or getting out of the bed. So once again, a study from Johns Hopkins Medical School says 25% of low back pain is actually coming from a misaligned pelvis, and a structural shift in the lumbar spine can cause herniated discs. As a Gonstead chiropractor, I help and correct misaligned pelvis and herniated discs all day long, every single day. This is my expertise, my bread and butter. So this is what I want you to do next. Please share this information on your timeline. You probably have some friends or family members who are in a lot of low back pains. They tried everything and they're possibly considering surgery, or they already had the surgery and they're still in a lot of pain, and you may not be aware of their condition. So when they see this video, they'll get the information they need. Okay? So once again, this is Dr. Ryan Suh. Thank you. Have a good night.